consultant, Apollo Hospital, Navi Mumbai. And so I'm just going to discuss what are the different possible questions in EDIC exam and how one should approach it, basically from critical care point of view, and what are the questions to be asked. So this is not a, basically you can say the lecture, I can say it's a discussion, 1:2 or something like interactive session. So where it is MCQ based, where I'll be talking to you regarding fewer options, and then I'll explain why these are the different options, which is basically true or false, or why this should be the right answer. What are the standard of care, and what are the different modalities that usually preferred in different parts of the world, and what one should do. Because toxicology is a vast topic. It is very impossible to cover the topic in 1 hour. So at least you need 3 to 4 lectures series basically in this. So to start my discussion, so it is the Paracelsus who initially defined what is the toxicology basically. So as per him, all the things are poison and nothing is without poison. So everything what you take in a very higher quantity is called as poison. The right dose differentiates a poison from the remedy. That is why whenever a patient ingests some poison, if the amount exceeds a particular critical amount, then the person is suffering from the overdose symptoms. But sometimes many of the poisons or many of the substances, when it is underused, it may not produce the signs and typical signs and symptoms what we observe in the day-to-day routine life. So that is the reason this is very important. So one has to decide what is the toxic dose for that particular patient and for that particular age group and for that particular, you can say the species. That is what called the toxic dose versus the right dose. Okay, so if we see the definition of toxicology, poisoning or intoxication, basically it is nothing but occurrence of harmful effects resulting from exposure to a foreign chemical or xenobiotics. So basically, so what are the harmful effects we get from exposure to a foreign chemical or a foreign substance? That is called poisoning or intoxication. So it is very different from known as overdose symptoms. So overdose symptoms means excessive exposure to a chemical. That is called overdose symptoms. Whereas intoxication or poisoning is the harmful effects resulting from the exposure. So these are the two different terminology what usually the examiner used to ask. So you can say these are the different area what we focus basically. So this is the normal water versus the flood. So when the flood happens in the water reflow in a very high amount, that can cause flood. Similarly, if the thunderstorm happens in a large or in a very massive amount, that leads to destruction. That the same thing applies in something called as the toxicology. So we have to always consider what is the good part, what is the bad part, and what do we aim at. Good effort is all these, sometimes most of the effects of a poison are predictable. That is the good part. The bad part is toxicology. The bad part is sometimes the overdose, the patient may continue to take it, and sometimes the effect may be multifactorial, like intracurrent illness may precipitate your overdose symptoms. So every poison or substance is very important because it is characterized by the route, duration, and what is the intent. Sometimes it can be accidental, sometimes it can be suicidal, sometimes it can be self-ingested, sometimes it can be because by some other person. That is a major thing. Any toxic substance follow the same principle of your drug distribution and pharmacokinetics. That is why the PK/PD of every poison is very important. How the poison get absorbed, how the poison get distributed, how the poison get metabolized in the body. So absorption basically depends on various routes. Usually the absorption follow the first order kinetic. And it is very important to note that how fast the therapeutic tissue concentration are reached. If the therapeutic tissue concentrations are reached more quickly and the effect then begin very soon. So this is called the first order kinetic. Most of the toxic substances, they follow the first order kinetic. Distribution of the substance in the body depends on the nature of the substance, whether it is hydrophilic or whether it is lipophilic. Hydrophilic means whether the substance get metabolized or easily dissolved in the plasma, or whether the substance get dissolved inside the lipid tissue. So this is called hydrophilic versus lipophilic. So any substance which is get dissolved in the lipid tissue, we find that the most of the initial substance, they get dissolved in the lipid tissue. Subsequently, they get released from this lipid tissue to the circulation, and they produces the secondary effect. Whereas hydrophilic substances, they usually get dissolved in the plasma and they get cleared through the kidney. So that is the reason hydrophilic substances are less dangerous. The secondary effects are less prominent, whereas the lipophilic substances, they are more dangerous, and sometimes you may get a secondary effect of this kind of substances, like organophosphorus. They get dissolved in the lipid tissue. After 4 to 5 days, the substance again from the lipid tissue, they come to the blood. They produce a secondary effect, which is something known as intermediate syndrome. Metabolism and elimination. Obviously, if the drug follows the zero order kinetics, if there is a small increase in the dose, this will have a bigger impact in the toxicity. Like most of the substances, what the day-to-day activity or day-to-day the person consumes, or commonest overdose, they follow the zero order kinetics. Like you consider alcohol, you consider phenytoin, you consider salicylates, you consider theophylline. So all these substances, they follow the zero order kinetics. So once the blood alcohol is saturated, the blood alcohol level is saturated, even there is a small increase in the blood level of the alcohol, this can produce a toxicity. That is why this is more dangerous. Similarly with the phenytoin, all these drugs are very, very narrow therapeutic window. That is why we have to be very careful. Salicylate, very, very unpredictable effects in a higher dose and also in the lower dose. That is why this is follow the zero order kinetics. Theophylline, most of the times asthmatics, they usually take these theophylline tablets. So even if they take slightly, even if the higher dose, that can produce the toxicity. That is why these poisons are very dangerous. General factors, what are the factors that depends, or the toxicity depends on various factors. So we need to consider what are the general factors, that is mostly the amount of exposure, how much time or how much amount the person has ingested, that is important. The agent itself, like whether it is a very toxic agent, less toxic agent, whether it is a cytotoxicity is more, neurotoxicity is more, so that is depends. Time lapse between ingestion and presentation. So more is the time, more is the toxicity. Like if a patient has consumed certain poisons, it came to us after 12 hours, and another person who came to us after 24 hours. The second person is obviously in a risk of getting more toxicity because of the effects. Protein binding. Most of the drugs which are protein binding in nature, they basically present or they produces more toxicity. Like you can say something like your benzodiazepines. So they sometimes produces more toxic effect because initially what happens, most of the drugs get protein bound, and subsequently they get circulated in the bloodstream, and then slowly the if there is a less protein or less albumin in a patient's body, so more drug is free and that they can produce toxicity. That is why the hypoalbuminemia in such cases are more dangerous. Organ functions. The different kind of agents that produces toxicity on different organs. For example, drugs which can produces effect on kidney, they can produces renal failure. On liver, they can produces hepatotoxicity, underlying disease, and many more. What is our principal objectives? First is recognize that exposure of the toxic substances has happened. Second thing, you have to identify the toxic substances. Third thing, you have to predict what are the toxic effects they may produce. Fourth thing, assessment of the severity of clinical effects. What clinical effect can happen as a consequence of this? So The treatment plans are fixed. First thing is resuscitation, resuscitation, and resuscitation. Any person who comes to you in a drug overdose, first thing is not to forget airway, breathing, circulation. So we have to answer in the same manner. Any patient who comes to ER, first thing is airway, breathing, circulation. Second principle is prevention of further absorption. We need to see that the toxics or the poison are not getting absorbed more and more. Like in case of organ of phosphorus, the poison may get absorbed in the skin also. That is why cleaning the skin and sponging the skin and or sometimes giving a bath in the soap water can sometimes be very useful in such condition. Fourth is enhancement of elimination. Like, do we need the substances to get eliminated from the body in a faster mechanism, like forced diuresis or purgatives. Purgative will eliminate the toxins from the gastrointestinal tract. Forced diuresis means giving Lasix and giving soda bicarbonate and IV fluid hydration will cause flush out of toxins from the kidney. Organ support. Any organ involved, we have to support, like kidney supports in the form of CRRT or dialysis, liver support in the form of CRRT or liver support in the form of something called as your artificial liver system or something like plasmapheresis. Those are important. Last is administration of antidote. What antidote does? Basically, it produces a chemical reaction so that it will chelate the toxic substances in the body. How do we approach? Very simple. First is sudden or unexplained illness in a previously healthy individual, history of alcoholism or drug abuse. Always ask for history of recent change in the health status, economic status, social relationship. Always ask for underlying disease condition, what drug the patient is taking, any psychiatric illness, like if the person is suffering from depression,